Good morning, everybody. My name is Nora Yates, Deputy Commissioner here at the Office of Children and Family Services in the Division of Child Care Services. This is our Community Conversations bi-monthly call for child care providers. We do have a special guest joining us that you'll meet shortly. But today's topic is around health-related topics. And so we'll be talking immunization and illness, and we've got our Director of Child Health joining us this morning as well. So we wanted to go ahead and get started. Thank you all so much for being here. You can go to the next slide. Interpretation is available in Spanish. If you are interested, there's a small globe in your lower left corner that you can click, and then you can change the audio to Spanish and kind of slide the dial so you hear Spanish while we're presenting on the webinar. So if you are interested in listening in Spanish, Andreas is here and is partnering with us on this webinar. Thank you so much. Since we do have a big crowd today, we do have folks muted for right now to minimize the background noise, but we will have this presentation. It is being recorded so that we can post it online as well as have it English and Spanish posted online. So if any of your friends missed this morning, they can definitely find it online after the call. Give us a couple days, but we will post it online. All right. Well, as I mentioned, we've got a full agenda today. We want to remind folks the purpose of Community Conversations. We, as I mentioned, have a special guest who will be joining us shortly, and we'll be hearing more about the state budget, the exciting state budget that the governor proposed last month. And the bulk of our time will be spent talking about various health-related topics like immunizations and winter illness. Unfortunately, it is the season. And our new Director of Child Health, Paula Hayes, will be kind of walking us through a lot of fantastic resources for child care providers around both immunization and different illnesses and preventing illnesses. And then, of course, there's always multiple topics that we want to make sure child care providers have on their radar. So we have a catch-all news you can use category. Before we jump in, we want to see who's here with all 84 of you. So if you want to play along, I know it's early for some of you, not for all of you. But if you want to click the QR code and slide over to Slido, you can let us know who's here, and we can see the providers, where you're located, and that kind of thing. So I'm going to play along as well, so I know that it worked. So we just wanted to see who's in the room. Great. Thank you so much for already 20 people signing on to Slido first thing. I love it. Good to see a variety of modalities here this morning. Thank you so much for being here. We've got group family and family child care providers, school age, a solid other category, which are our many stakeholders, our Quality Stars partners, our CCR&R partners. Thank you so much for being here. Sorry, CCRCs. I will get there. And then our daycare center directors, teachers, assistant teachers. Thank you so much for playing along. It seems to have slowed a little bit. Hold on. Awesome. All right, we are now into the regions. Thank you for that. So where are all of you located? Usually we have a good kind of geographic spread for these calls, which is fantastic. Looks like New York City has removed all of their snow and has joined us this morning on the call. So that's great. Hope you all didn't shovel too quickly and hurt your back. I heard it was raining in Buffalo yesterday, and so there was a little bit of glee in folks in Western New York's voice that they were like, we haven't gotten an inch of snow from that storm. That's great. So it looks like we've got folks from every region, which is fantastic. It's fantastic. Thank you to the 40 folks playing along. All right. Hold on 1 second. I'm just making sure. I'm getting emails about technical difficulties, so I'm just making sure that everything is all set. Okay. Since you all did such a great job with the QR code, we figured we'd keep that moving. We want to hear more about how best to communicate with you and how best we can leverage these calls. So we did launch a short survey that if you're interested in completing, about these calls about community conversations, should only take you 5 minutes. But we have extended the deadline. The link is here, but we will also send out the link again, and just wanted to hear timing, format, interpretation, distributing the information afterwards, that kind of thing, making sure that these calls are useful for our community. I know it's a small number attending this morning, but many more access the information on our website as well. So if you want to participate, please do. We'd love to hear from you. All right. Hold on 1 second. My apologies. Okay. Well, just to remind everyone, the goal of these calls are fantastic. These calls will continue bi-monthly. We do have interpretation in Spanish. So as a reminder for those folks who did join a little bit late, if you want to hear this call in Spanish, you can click the small globe in your lower left corner, and you can change the language to Spanish by sliding the audio information. And then we do have our partner, Andreas, conducting live interpretation for the call. If you have any questions or topic suggestions, please feel free to email them to us, and in the subject line, put community conversations. And then, as I mentioned, we will post all of our recordings online on our website after a few days, after we get all of the information completed. Fantastic. Well, as I mentioned, we do have a special guest star this morning, and we are thrilled to have our commissioner, Dr. Dami Harris Madden, here with us. Good morning, Commissioner.
Good morning.
Hello. Thank you for struggling through the technology this morning.
I appreciate it. It's better than the snow that we have here, which is well beyond my waist when outside.
That is crazy. Well, I'm thrilled you're here. We've got a lovely attendees this morning and wanted to hand it over to you to talk a little bit about the state budget updates.
Thank you so much. And it's really a pleasure to crash your party. I realize that most are on mute and you can't say good morning back, but I want to say good morning. It is bright and sunny out. And for those of you who are in areas that, feel like it's more than abominable snowman that's at your door. I wish you all the best in terms of commuting to work and or cleaning up around the house. I'm really thrilled and I appreciate the invitation from Nora to kind of crash this morning. And I actually look forward to listening in a little bit and possibly returning in the near future as, we continue to monitor the executive budget for 2026 and 27. The big piece to this is something that we cannot do without all of you. And that is to achieve universal childcare. I think we all share that fundamental desire for our children to have safe, high quality care at no cost. However, I am very pleased that at least since joining OCFS, I've learned a great deal. Much of it has come from Nora around, what we've done so far. And I'm very proud to serve a governor who understands the importance of early childhood experiences and has made it a priority for childcare to be affordable. I'm also very grateful that in serving in part as the co-chair to the Child Availability Task Force, that I got to meet many of you and talk with some of you in terms of the services you provide and your desire to serve the tiniest and most precious children across New York State. So I want to again say thank you. You've enlightened me, and shameless plug, I am traveling New York State speaking about the budget. So if there's anyone on the line listening that, would like to host me and the OCFS team to come in and talk with your networks, please let us know because we'd be happy to do that. But again, I'm just going to delve into this year's budget and the governor's priorities. The governor obviously champions safety. She has invested a great deal in safety, mental health. She continues to invest in mental health. She also continues to invest in infrastructure, and she's really underscoring the need and desire on the part of the state to cut the red tape. And we know that so many organizations struggle with all of, our regulations and our applications, and some of them have been streamlined, and we are grateful to Nora and the team for doing that. The governor has challenged us to go a little bit further. So we're going to be looking at ways in which we can make doing business with the state a little easier. That said, the other platform is childcare. And, our path to universal childcare is relatively clear. We are excited that since Governor Hochul has taken office, she has invested about $8 billion in the childcare system. This year, she is going to be investing $4.5 billion in our system. And I don't think any governor in history has made more strides in this space than Governor Hochul. So again, very proud to be in a position to support these efforts and also to support all of you. So how does this $400 billion translate to what we're talking about today in our childcare space. So we're, obviously going to be building on existing investments. We're investing about 1.2 billion in childcare subsidies through our CCAP program and increasing the baseline for funding for CCAP to $2.4 billion. Nora has outlined here 1.2 investment, which totals 3 billion. However, there are different pieces to the child care assistance program. And what we've seen in this budget is that it is a 40% increase from what was available last year. So we're excited about that. But in addition to that, the governor is looking to, kind of test to see how we can pilot truly universal childcare. And one of the things I want you all to know is while we champion all aspects of childcare, I know that there's some concern with home-based providers, family providers who believe that, they may be left out of this. I want to reassure you that that is absolutely not the intent. We've talked about the great need in New York City, but also the rest of the state. And we know that New York State is so dichotomous. Things look very different as you go travel throughout the state. So the pilots that we are implementing, one will be To Care in New York City to the tune of $73 million. And, New York City will completely handle how they will establish this initiative. The other is we are looking at 3 other areas, which include Broome, Dutchess, and Monroe counties, which we will provide $60 million to this piloted program to offer additional childcare options. So it could be, through contracted care, which is likely the model that they're going to use. And there is a specific focus on children under 3 years of age. In addition to that, the governor has invested funds into universal pre-K so that by, the school year of 2027 and 2028, universal pre-K for 4-year-olds will be in existence throughout New York State. And I know that there are some areas that have struggled with this, but the whole intent is to make more room in the system of, again, not burdening, or I should say, not exhausting CCAP funds, rather to kind of move the 4-year-olds along the continuum into pre-K 4. And the hope there is to truly strengthen the 3K programs in New York City to see how that works, right? So, there's this significant investment in terms of looking at, how we can invest in these various opportunities and see what fits in each community. And that's the beauty of pilots. So, we are tasked with a lot in OCFS, but we're very confident that with your partnership, we will get these things done. I want to also add another area that we're placing great emphasis on before I close, which is the expansion of the Empire State Credit. This is the state's tax credit that, some of the work that is being done around reducing childhood poverty. Childhood poverty is a major concern. We want to make sure that our children have the resources that they need. But in order to do that, we have to work with our families. And we are encouraging our families effective, this tax year to maximize the credit from, $330. It's grown to $500 for children ages 4 through 16. But also there's the benefit of, having the expanded child independent care tax, which expands up to $575. And we anticipate at least 230,000 tax filers will benefit from this. It's a start. It's a boost to the state's child tax credit. And we hope that folks take the benefit of this because, we know there's some trepidation around the federal government for some folks who just may walk away from filing taxes. We encourage our parents, our providers, our team members to please take advantage of this, because this will generate money back into your pocket. And that is one of the messages that the governor has been trying to send. So, there's lots more in the budget, but right now, we're sticking with the childcare elements of this. When I am doing a full road show, I'm able to kind of talk about the other areas within OCFS that is being funded. Again, the primary being the path to universal child care. But then there are other benefits that, we see to share with the public, which includes, positive youth development features that are maintained in our budget, not necessarily increased in our budget. There's some legislative items as well. So, we are grateful for your time. I am certainly happy that Nora's allowed me to crash this party and talk to you a little bit about what's in the budget for you. And we hope that you're able to ask the questions that you need. I guess the format would be after. And, if you need additional information, we, of course, will provide it. And again, if you have networks or you have a group of providers that you'd like to hear this full presentation, do let us know. Thank you.
Thank you, Commissioner. Thrilled to have you here. Thanks for walking us through some of the state's priorities. I want to reiterate, and we're going to say it again, and we're going to add it to the presentation about the tax credit. We're going to be sending information out to providers to make sure that they can highlight for families the tax credit and its expansion, and making sure that they, are filing taxes, and most importantly, knowing that if they are on any benefits like SNAP or HEAP, getting this credit does not affect their benefits or their eligibility. So if there's concern about their eligibility for those programs, we have FAQs that it will not affect those programs like Medicaid, SNAP, SSI, et cetera. So we wanted to make sure folks were aware.
That's right. Thank you so much, and have a great day.
Thanks, Commissioner. Great. All right, we can go to the next slide. All right, well, let's head over to the Paula Hayes Show, as we call it. So Paula Hayes is our new Director of Child Health. We are thrilled to have Paula join. She is a family nurse practitioner. She knows all the things about both immunization and illness, and we're thrilled to have her as a resource for providers and our stakeholders. So we wanted to have Paula walk through some key topics. There's never enough time to get through everything, so we will be doing more Paula shows on various topics. But Paula, I'm going to hand it over to you.
Good morning. Thank you, Nora. Good morning to everyone. I just want to say I'm happy to serve as a resource to your programs, and I'm super happy to get to talk to you this morning. I'm going to talk to you this morning, as Nora mentioned, about immunizations and common winter illnesses that you can see in childcare and out in the community. The information in this presentation is not intended to be medical advice. We can flip to the next slide. So this morning we're going to talk about immunizations. I'm going to review the vaccine requirements for childcare. We're going to talk about some different immunization charts you may use in your programs. We'll review the medical exemption process, how to obtain access to the Health Commerce System, NICES, and CIR. We'll also look at a sample NICES report, and we will review a worksheet that may help you with preparing for the Child Daycare Immunization Survey that's opening next month for daycare centers. And then we'll switch gears. We'll look at some common winter illnesses, talk about symptoms, management, and prevention. We can flip to the next slide. So, as childcare providers, you all play such an important role in ensuring the health and safety of the children in your programs. So what do vaccines do? Well, vaccines really protect the health of the vaccinated, but also others around them that can't be vaccinated due to a medical condition or age. They really help control the spread of illness. So a community that has high vaccination rates will have a much slower spread of illness than one that doesn't. And vaccines greatly reduce the symptoms and the likelihood of complications if the person who's vaccinated does contract that illness. They're going to do far better than the person who didn't have the vaccination. And amazing fact, in the past 50 years, on average, 6 lives every minute of every day have been saved because of vaccines. And we can flip to the next slide. So what vaccines are needed for your little ones in childcare? For children who start their vaccines on time, they will eventually need 4 doses of diphtheria, tetanus, and pertussis vaccine, 3 doses each of hepatitis B and polio vaccine, and 1 to 4 doses of Haemophilus influenza B or Hib and pneumococcal vaccines, depending on the age that the series was started. After their first birthday, they're going to need 1 dose of an MMR vaccine and 1 of varicella. And then additional boosters are given to these children before they go to school to ensure long-lasting protection. Childcare providers can review the catch-up schedules for more information about children who might be behind on vaccines in their programs. And remember, until children are about 18 months of age, they're going to the doctor fairly frequently to get checkups and vaccines. So as a childcare provider, just make sure that you are following up with parents to get documentation or reviewing that documentation in the NICES system, which we're going to talk more about in a few minutes. And we can flip to the next slide. This slide is really busy, a little bit overwhelming, right? So knowing which vaccines are due when can really be a daunting process. Knowing which chart is the best one to use or the easiest one to use definitely can be a difficult process sometimes. So, having the right chart and the right tool really does make the whole process easier and definitely decreases anxiety. The chart on the lower left side is the New York State Child Care chart for immunizations. And that is my favorite chart because it is just the immunizations that are needed for childcare. The childcare provider doesn't have to sift through anything else. It just tells them exactly what's needed until those little ones get to kindergarten. And then the chart in the middle is the school age chart. And that chart also gives all the recommendations and requirements for childcare, but also through grade 12. So you can find what you need in this chart, but you do have to kind of look through things. And then the orange chart is the AAP chart that's in the upper right corner. That is also for birth to six years of age, but it's more, it has both the recommended and the required vaccine. So again, we have to sift through that a little bit. Many people do prefer this chart to the CDC chart, which is in the upper left corner, which many of you may be familiar with. The CDC chart is fine, but it's really geared towards healthcare providers. And some of the things may be a little hard to match up with our New York State requirements. So remember, New York State immunization requirements have remained unchanged in the recent past. And we can flip to the next slide. So medical exemptions. What is a medical exemption? A medical exemption allows a person who's not fully immunized to attend a childcare program or school in New York State. This form on the right is the DOH 5077 form, and this needs to be completed if a child needs a medical exemption to a vaccine or vaccines. There is no substitute documentation. The form is submitted to a program, and the program can approve or not approve the exemption depending on the documentation. This form has to be completed by a physician in New York State. And if the exemption is approved, it needs to be renewed annually by the physician in the program. You can always reach out to your healthcare consultant and your regulator if you have more questions or need some guidance. You also need to be aware that there are some fraudulent requests out there, and some clues that you might be dealing with one of those is getting an exemption request not on the form, or from an out-of-state provider, or a provider who's not a physician, or the information contained in it is just very generalized and not child-specific at all. Programs can also request additional information from the parents to support the exemption if needed. And we can flip to the next slide. So programs can sign up for the Health Commerce System by clicking on the link on the website that says sign up here. If they do have trouble getting signed up, there is an account helpline, and the number is on the slide. The New York State Child Daycare Survey for daycare centers is completed yearly in the Health Commerce System. Currently, there's just one for the daycare centers and not for group family daycare, but the group family daycare survey may be returning in the future. That survey opens tentatively on March 9th, and you will be getting some more information on that in the coming weeks. Remember to keep your program information up to date in the Health Commerce System, because that's how you will receive a lot of information regarding the survey and other important topics. So once a program is set up in the Health Commerce System, they can then establish a New York State Immunization and Information System, or NISIS account. You complete a brief training, and then you have access to the database for all children under 19 receiving immunizations in the state. It can really help your program save time with meeting your immunization and health regulations. And I did include a link on the slide here for any frequently asked questions regarding the program. And we can flip to the next slide. For programs in New York City, the CIR, Citywide Immunization Registry, is similar to NISIS, but it's only for New York City. It's managed by the New York City Health Department. And for access and more information, you can check out the New York City Department of Health website. And we can flip to the next slide. Okay, so this is a NISIS report. Hopefully you can see this okay. This is really exciting to me, because to me, this just makes your job so much easier in figuring out what's needed when. It may look a little overwhelming right now, but once you get used to it, it really is very simple to look at it. It really takes the guesswork out of everything. So you can see on the top, it's the identifying information for the child. And then the next section is the history. That tells you in the first column the name of the vaccine, the dates that the vaccines have been given, and then how many of the vaccines in the series have been completed. Remember, kids can be up to date with their vaccines for age, but may not have completed their series because they need to receive those boosters again before going to elementary school. The next column is the actual vaccine that was received. So there are different formulations. There may be a vaccine brand name there. And then beyond that is the vaccine tracking schedule. So what's due next? If your series isn't complete, you can look down to that section and you can see when the next vaccine is due. So then you can very easily know when to request more documentation from the parents. Or if you have access to the system, you can look up and see in real time when the vaccines have been given. And it makes chasing down parents for vaccine information and records a lot easier. So you can see in this report that Olivia only has 2 of the 3 required hepatitis B vaccines. So you can look down below in the vaccine tracking schedule, and that will tell it the hepatitis B is bolded because it's overdue, and the date that the vaccine became overdue is bolded. So Olivia would need to receive the third hepatitis B vaccine, submit documentation that she'd had it maybe in another state and it didn't make it to this record, or she would need to receive a medical exemption for the third hepatitis B vaccine. Another really nice bonus about this report is the lead testing results are here. So if the testing has been done, the date and the results will be here. So remember, per OCFS regulation, the program has to ask for the lead testing results from the parents. Those are usually done at 1 and 2 years of age. But if the parent doesn't have it, or they can't locate it, they forget to bring it, you are then responsible as a child care provider to give the parents information about lead poisoning and refer them back to their healthcare provider or the public health department for lead testing. And we can go to the next slide. Okay, and so this is a sample of the worksheet that you can use to prepare for the child daycare immunization survey. It's not submitted, but it helps you total up all of the information in your program and get it ready to be reported in the health commerce system. So in the first column, you can see in the upper left box is the total number of children in the program. And then below that are the children's identifying information, their name and date of birth. And then in the second column, you would mark an X there if you had a child in your program that didn't have an immunization record. Most children wouldn't be in a child care program more than 14 days without an immunization record. And then the third column is a child with a medical exemption. You can see for Jason in this example that there's an X in that column because he has a medical exemption to the hepatitis B vaccine. And then his hepatitis B vaccine doesn't have an X in that column. So for each child, you're going to go across from column 4 through 12 and put an X in each place where they meet the immunization requirements for that particular immunization. Column 13 is where you would put an X if the child is fully immunized. So you can see that Abby is fully immunized, so she has an X in that box, and Jason doesn't. For column 14, that's for immunizations that are in progress. So these are children that may be behind on vaccinations, but have a plan to get caught up, have appointments in order to get caught up. And then column 15 is where you would mark if you had a child who was homeless in your program. And then at the bottom of the report, you would tally up all the X's, and these totals are going to help you when you're actually reporting the numbers into the survey in the health commerce system. Programs, depending on their size, may need more than one sheet, but this is a really great resource in making sure you're reporting the information correctly. And we can move to the next slide. Okay, so now we're going to shift to the discussion of winter illnesses. Illnesses definitely spread more easily in the winter when we're all indoors, breathing the same air, and have limited access to fresh air. Frequent illnesses we see in the winter include the flu, COVID-19, RSV or the respiratory syncytial virus, the common cold, gastroenteritis, very often caused by norovirus, but can be caused by other viruses as well. Many illnesses in the winter are self-limiting, meaning they get better with time, but they can still have a major impact on your program once introduced. These infections can live on surfaces for minutes to days, and that really depends on the germ and the sanitation practices of the program. To decrease the spread of illness, programs can provide frequent reminders and time for cleaning and disinfection of toys and surfaces, and also reminders for hand washing. Because remember, hand washing is the #1 way we're going to prevent the spread of germs in our programs. And we can flip to the next slide. This chart reviews winter illnesses, including flu, COVID, RSV, and gastroenteritis. You can see that many of the symptoms are the same for a lot of these illnesses. And because these illnesses are viruses, the mainstay of the treatment is pretty much time and symptom management. Also, because the incubation period varies, that's the time from when someone contracts the illness to when they start feeling sick, that many people can be spreading these illnesses and not even know that they're sick. Some people are unable to wear a mask due to their medical condition or age. And remember, we should never have masks on children under 2 due to the risk of suffocation. Many of these illnesses can be lessened in severity by vaccination. So the vaccines for these illnesses are not required by New York State for childcare, but they may be recommended for children and staff in childcare programs. Excuse me. Certain age groups and populations are at an increased risk with many of these illnesses. So, for example, the flu or COVID can devastate someone with a history of asthma or COPD. And RSV can cause severe symptoms in infants or the elderly. Where a school-age child may have very mild symptoms, they can still pass those germs on to someone who may be more susceptible and have more severe symptoms. Infants could be hospitalized with any of these respiratory illnesses because of their smaller airways and limited experience or immunity to many of these infections. Gastroenteritis can devastate an infant because of their smaller systems and their inability to take fluids in ways other than breast or bottle feeding. Infants are nose breathers, and if they can't breathe through their nose, they're not going to be eating very well. And that can lead to dehydration and further compromise. As always, if you have children or you yourself or staff are experiencing illness in your programs, it's always best to check in with a healthcare provider to receive specific instructions and recommended treatment and medications if needed. And we can flip to the next slide. Okay. And what can programs do to manage? Well, I know many of you are doing all of these things, but these are just good reminders that, we can include hygiene measures such as washing hands frequently, sanitizing surfaces and toys. Daily health checks are always important, but can be vital during these winter months. You may be able to pick up on something really early before that child or staff member is very, very ill and has to leave your program. Children and staff should be taught to stay home when they're feeling sick. They can also be taught respiratory hygiene measures like coughing into their elbow, using a tissue, washing their hands, using gloves, and sanitizing when needed. Staff and children can be taught to encourage thorough hand washing by songs like singing the happy birthday song twice to know how long you're supposed to wash your hands for. Vaccination for many of these common illnesses can be encouraged, and make sure that you have an updated illness management plan on your healthcare plan so parents know what to expect. And we can flip to the next slide. And this last slide shows some of the educational materials for illness prevention that are available on the New York State Department of Health website. There are many more, so check out the site, and you can print these off and you can request these materials, These are just a few of many, many, many that are on there. Thank you so much for your time and attention today, and I'm going to give it back to Nora.
Thanks, Paula. As I mentioned, we're going to have more Paula Show presentations coming up, so stay tuned for a webinar specifically on immunization requirements in April. We'll be setting out that information very shortly, and that webinar will include questions that we're receiving, on specific scenarios. But if you have questions, please feel free to send them to the main email address that's on the screen with the subject line immunization, and we will work with you on responses or the resources that you need. And I just want to put another plug out there for your childcare resource and referral, or childcare CCRC, because they can also be a tremendous resource with healthcare consultants, and also your regulator is a great resource as well for specific scenarios that come up in your OCFS licensor. Great. Well, we're going to keep moving in these last few minutes. I'm sure that Andreas has been going very quickly through these slides, so thank you again to our interpreter for bearing along with us. And we're going to move to our kind of updates for providers, making sure things are on your radar. We do have a newsletter that comes from the Division of Child Care Services, and the January newsletter is now available. It did go out in English and Spanish, so you should have it in your email box. If you do not, it is posted online. I know you have all read it and love it, but wanted to highlight for you that the January one is out, and that comes out quarterly. You can go to the next slide when you're ready. All right, I'm going to hand it over to Chris Coons to talk a little bit about upcoming trainings on supervision.
Good morning, everyone. We are thrilled to share that we have added some additional dates to the Active Supervision Training Series. As a reminder, we are on session number 2, which highlights the principles of environment and staff supervision. And as you're all aware, competent supervision really is the foundation of what we do, the foundation of our child care regulations. It is absolutely imperative to help us prevent injury and to maintain the health and safety of kids in our care. So the purpose of this Active Supervision Training Series is to highlight 6 supervision strategies that Head Start has shared with us. Session 2, again, highlights the 2 on environment. So setting up your environment with active supervision in mind, and an environment that will help children to explore safely. And then the staff supervision piece provides you with effective strategies on how to position your staff within that environment to maintain safety. So the purpose of these sessions is to help share effective strategies for you to consider implementing within your program. All of the trainings are available in both English and Spanish. Providers do receive 1.25 hours of training credit, and they are all available at no cost. We have been thrilled with the feedback, and we are very excited to continue to offer more training deliveries. The seats fill up very, very quickly, which also makes us super happy. And we would just like to ask, and recognizing that life changes and that everyone signs up with the best intentions, if you know for sure that you are not going to be able to attend a training series that you signed up for, if you could please just log back into your account and cancel out your registration, we would appreciate it. Our training partners are fantastic in maintaining a wait list. And so your canceled registration allows us to pull from our wait list so that we can keep all of those seats full for more providers. Next slide when you're ready, Andres. Childcare program texting. So this is another way that we have worked to connect with you, to stay connected, to share more important information and improve communication between us and you. We are thrilled to announce that so far, about 5,500 programs have opted in to childcare texting. There are two, easy ways to join. If your program is in FAMS, and we are hoping that you are in FAMS because our online application is improving every day and really helps us to move away from the administrative burden of paper. You can log into program maintenance in your FAMS account and opt in to receive text messages. And if you have not yet joined us in FAMS, there is a link on our website that will take you to a quick OCFS Microsoft form, and you can opt in that way. Just to put another shameless plug in for FAMS, if you haven't checked it out yet, please go to the Training and Resource Center that is available on our website. There are all kinds of training resources there for you. There is a dynamic video that will show you how to utilize FAMS in English and Spanish. There is a plethora of written tip sheets in both English and Spanish. And then there are provider training sessions that are held live. So you could join us, log in, much like this forum, and have your questions answered. It really does make applying, renewing, and managing your facility application much more streamlined and easy for us all. Next slide, please. Nora, I am going to pass this one back to you.
Yes, thank you, Chris. And please, everyone, sign up for the training and make sure that you're keeping your registration for the training current. And then also, please use FAMS and to opt into texting, because we can remind you when Dear Provider letters come out and grants come out and other things. This is a reminder about the tax credit that we talked about at the top of the call. The tax credit information, there's several flyers and outreach in all languages, in all 12 languages. Like I said, the lowest income households can obtain the full credit. So making sure that even if a family isn't filing taxes or hasn't filed taxes or is nervous about it, that they're aware that they're eligible for the credit if they have children ages 4 to 16, and that it will not affect other benefits that they may have. So we will be sending out information about the tax credit, and we want to make sure that all of our providers and our families are aware. We can go to the next slide when you're ready. All right. Well, in remarkable time, we have made it through. And thank you so much, everybody, for joining. Please send in questions or topic suggestions. Like I said, we will be posting the recording and the PowerPoint slides online. Our next community conversations is April 28th. And so you can register by clicking the link, but we'll also send out the link and you can register for the call and get that on your calendar. Thank you so much for being here and for sticking with us, and stay tuned for more announcements about the health webinar, the immunization webinar. Thank you so much. I hope everyone has a great day.